Thank you again for joining with us, and we'll be highlighting medical billing and coding. Again, my name is Shannon Scriven. I am one of the Career and Education Outreach Specialists. I serve Pflugerville, Elgin, and Manor ISD. And today I am joined by my colleague, Jessica Garay. She's going to be helping me in the chat today. And also on the call is Ashley King, who helped put this presentation together and bring in some wonderful speakers for us. Okay. All right, so we can go ahead and move forward. So many of you may already know, but definitely follow us on our social media channel. Our YouTube is WFS Capital Area, and then we're also on Facebook, Twitter, Instagram, and LinkedIn on the same handle. So through this, we post all of our upcoming events, which we do have quite a few coming up, which I'll share with you all at the end of this presentation. And we also post wonderful opportunities that are available to your students or your clients or the population that you work with. And if you do have any students who need any assistance with, or clients who need any assistance with their resume or some career or information on different trainings that we provide, our email address is on the screen here at careerladder@wfscapitalarea.com. Okay. All right, so I'm just going to do a brief overview of our speakers that we have here this morning with us. They're going to get a little bit deeper into who they are, and they'll introduce themselves as we move further into the presentation. But this morning, we have Norma Mercado with us. She's a department chair professor with Austin Community College. And we also have Mary Kay Keaton with us. She's the Health Information Technology Professor with Austin Community College. And then we also have Vicki Constancio. Sorry if I pronounced your last name wrong. She's the Revenue Integrity Lead with Community Care. Okay, and they'll introduce themselves a little bit more as we move further into the presentation. All right, so for our agenda today, we just went over our welcome. Next, I would love if you all can introduce yourselves into the chat box. Let us know, your name, where are you from, what organization are you representing today? And then we're going to go over some labor market information, and then we're going to have our panelist introduction, a Q&A session, and any winter updates that we may have for you. And then we're going to close out our presentation. So it should be fairly short presentation for this morning. All right, so a little bit of labor market information, and I know for this presentation today we'll be highlighting medical billing and coding, but for the sake of this labor market information that we're looking at today, it'll really only highlight medical coding, which isn't too slight differently from the billing portion. So for the medical coding portion of this, what we're looking at here are the top employers in the Austin MSA area who are currently hiring for medical coders and billers. Okay, so I'll give you some time to just briefly look through the list.
And I'll add, this is Jessica Gray. I am the in-house labor market analyst, and these employers are top employers for medical coding. So these are based on real-time intelligence. So that's going to be online job postings that each of these employers have posted on major job boards such as Indeed.com, LinkedIn, and the data that we use is from, I think, over 50,000 job boards online. So this is what currently it's showing for the Austin MSA for the highest demand and the highest posting concentration for these employers. Not to exclude some of our other employers by any means, but this was for the last 12 months for the Austin MSA.
Thank you for that, Jessica. Okay. And moving on, so what this shows us here, it shows us the average job postings within the last 12 months, like Jessica just mentioned. So quite a few job postings have been put out. And then it also tells us the time to fill the position. And then we see a projected growth of we can round it to about 12% for this industry. And then I also included some skills that are needed for this position to become a medical biller and coder. So we see the specialized skills. And then we also see the baseline skills. So our baseline skills are going to be like those soft skills that our students need to have in order to succeed in this position. So being very like detail oriented, having great communication skills, knowledgeable in Microsoft Excel, teamwork, things like that. And I'll also give you just a little bit of time to review the data here. And Jessica, if you do have anything to add, please do so.
Yeah, as y'all look at the top skills, specialized and baseline skills, what I take away from this, having previously worked with clients and students, is really, especially those who are job coaches, advisors, is working with your students to ensure that their skills are outlined on their resume, for one, because that's what employers look at, but also in your curriculum development, really understanding where the trends are for medical billers and coders and ensuring that's in your day-to-day learning for your clients. And so I know our panelists on the call are going to bring these skills to life for us and really go to the day-to-day what a medical biller and coder does. But this, for me, helps me understand, the sort of training that needs to be developed for clients, and then also what needs to be listed on their resume, or even seeing if there's any transferable skills such as communication skills. Really, maybe someone's new to the profession, but they previously worked in retail or food service. How can we really help them address their communication skills or even teamwork and collaboration so they can then transfer that to the job site working in the healthcare industry? And as far as other LMI, there is an average demand of over 2,000 job postings in the last 12 months, and there is an expected growth. I will also add that the medical biller and coder occupation is on our targeted occupation list for our workforce area, which is Travis County. So Workforce Solutions will provide a scholarship to clients who qualify to pursue training in this profession, whether it's with ACC or any of our other partners locally that offer this sort of training. It's a high demand job. There is a promising pay. And so that's why we're highlighting it today.
Thank you. We have one more slide. This tends to be my favorite slide, especially since I work very closely with our students in the school districts. And we all know, money talks for students. So once they see the average amount that they can earn within this position, but not only that, but want to point out the related job portion of on the screen here. So if you do have a student or a client who is possibly interested in becoming a medical coder, and they've done their research, but they come to find out that it's not really for them. They don't think they really want to do that, but they want to do something in the healthcare industry. They're just not quite sure. I always turn to the related jobs chart because here it shows us the jobs that are closely related to medical coding and then those that are not so much related to the industry. So if we take a look at the circles that are closer to medical coder, those are going to be the ones that mostly relate to the job industry. And then the ones further away are within the healthcare industry, but they're not quite exactly going to be the same thing that a medical coder or biller does. Okay. And while you take a look at that, we can move over to the salary range. So the median annual salary for this, and again, this is for Austin MSA area, we're looking at $37,321. Okay. And then some more on the higher end, people in this industry can expect to make around $44,000 in the industry. Okay. Jessica, is there anything you'd like to add on this one?
I'll add, we had a question from Raquel with American Youth Works about the location quotient. That's a good question. So medical billers and coders have an average LQ, location quotient. So what that means is we have an average amount of medical billers and coders in our area compared to the rest of the nation. Now there's some occupations, I'll point out one that I looked at recently, like semiconductor processing technicians, which is in manufacturing. That's a very high location quotient, which shows the demand we have for manufacturing lately and the demand for that sort of skill and occupation for our area. But on average, we have, compared to the rest of the nation, an average amount of medical billers and coders, which may be a really good data point to look at for anyone looking at leaving our area. Like, where is a higher location quotient or higher demand, especially someone who is skilled in that, certified in it, and they're interested in traveling. Of course, we want to keep our job seekers local, our professionals local, but that may be an interesting point for anyone willing to travel or looking to work outside of the area. This information is also on our career profiles. I will not say, I'll say the median annual salary is from one of our LMI subscriptions. So I would not necessarily look at that as much as you can look at what the capital area LMI produces for wages. I'd have to cross-check it. But I'm going to link y'all in the chat a career profile that you can use for your students. And what it does is it breaks down what Shannon shared today related jobs, but also the wages, the education required. It even has a QR code so you can learn more about the profession as well. And it's only like a 3-minute video that talks about it.
Perfect. Thank you, Jessica. And that actually leads us into our next slide as a career profile. So just like what Jessica mentioned, at Workforce Solutions Capital Area, we have created career profiles to highlight different industries, not only in the healthcare industry, but many other industries.
Hello.
Oh, hello.
Hi there. Do you have a question?
Okay, I think it was an accident. So yeah, through our occupational profiles, which Jessica will link in the chat for us, it highlights our targeted occupations list. And what this basically means, it's occupations for which Workforce Solutions Capital Area will be able to provide funding for and assistance in things like tuition, transportation, and childcare assistance. And we assess this year on an annually basis. So every year we, get back to the table and we see which careers are currently in demand in the Austin Travis County region. And if you do have any students who are interested in, those resources that I just mentioned, we do have our Rework Now website, which we can also drop into the chat for you as well, which will show you how you can be linked to these different pathways, such as medical records and health information technician. Okay, and on the career profiles, you also can see the annual wages. So we list from entry level to the high end of medical records and health information technicians, which I would point out, it's the same thing as medical biller and coder. Okay, and it also gives you a breakdown of the hourly wages. And I do also want to point out where it says education, certification, that is for entry level. Okay, so if you do meet any students who, say they want to go into this field, please let them know that you can start at a certification, but you will have to continue your education a bit further, to reach a median or high end wage. Okay. And one other thing I want to point out here on the profile is that on this profile, the Austin MSA area projects that there'll be a need of over 2,000 medical records and health information technicians by the year 2031, which is quite a few. And the video that Jessica mentioned is on the career profiles as well. There is a QR code that your client or your student can scan. And basically what the video will entail, it will give a detailed overview of what this industry or what this job title entails. So we have medical billing and coding. And this is where I'll go ahead and turn it over to our panelists to allow them to just briefly introduce themselves, and then we'll jump into the Q&A session. I will say, I don't think Mary Kay Keaton is here with us this morning. Maybe she would join with us a little bit later, but we do have Norma and Vicky on the call with us. So Norma, if you'd like to go ahead and introduce yourself.
Yes, I'm Dr. Mercado, and I'm the department chair for Health Information Technology at Austin Community College. Right now, what I do is I advise students. I do teaching at Austin Community College. Did you want me to go into more of what a coder does at
No,
this
that
point?
was, no, yeah, that
Okay,
was good. That was a great overview. Thank you.
okay.
Perfect. And Vicky, if you'd like to go.
Hi, my name is Vicky Constancio, and I am the Revenue Integrity Lead for Community Care Health Center. I was a nurse for 27 years, and I left the workforce for a while, and then I rejoined the workforce as a medical billing specialist for Carousel Pediatrics. And during that time, I obtained my certification in professional coding and pediatric coding. And I am now working with community care in their revenue integrity area.
Perfect. Thank you. Thank you so much. All right. And that leads us to our first question for today. And we can go in order of Norma and Vicky. If you can briefly speak on your educational background and a little bit more about your current place of work.
Okay, basically, I have a doctoral degree in education, a master's in human services administration, and a bachelor's in medical record administration. And basically, with that, I took my registered health information administrator national exam. So when you have an RHIA, RHIT, and CCS, CCSP, you can also work as a coder. And my current place of employment is Austin Community College, but I do want to tell you about when I worked as a coder. Basically, we started at about $1 million in deficit on a Sunday. And by Thursday, we had to code down to as much as possible, preferably a zero balance by Thursday. So basically, this is a type of productivity job. You have to code at a certain speed. Basically, you code, if it's inpatient, you code about 5 records an hour. If it's outpatient, it's going to be more. Any questions on that?
Norma, if you share the wage, was it the wages you just shared? I can put those in the chat if you'd like to repeat it.
Oh, no, that was the number of bills that we had that totaled $1 million on a
Okay.
Sunday. And we had to code down to 0 if possible by Thursdays.
Yeah, that sounds like a lot, a lot of work.
And sometimes you're not the only coder. A lot of the times the inpatient hospitals have about 30, 45 coders. So they start out with $7 or $8 million on a Sunday. And by Thursday, they're really down to almost nothing because they have 30 or 45 coders. Now, if you work in a small facility and you're the only one, well, then you've got a lot of work. But hopefully you won't be the only one and you will code down those bills.
Thank you, Norma.
Mhm.
All right, and Vicky, same question for you.
Well, I think I accidentally spoke on my educational background in the beginning, but as I said, I was a nurse for a long time. And then I re-entered the workforce after being a housewife for about 10 years. And I had no, believe it or not, I had no coding or billing experience when I was hired at Carousel Pediatrics. I was just asked to step in based on my past medical experience. So I learned on the job, and I became certified through AAPC, which is the American Academy of Professional Coders. And I have my certification in professional coding and in pediatric coding. And like Norma said, we basically translate diagnoses and services provided at a visit from words into numbers and codes. And those codes are sent to insurers or payers so that we can get paid for the services that we provide. And what I do now is I've moved up from coding into another part of the revenue cycle, which is revenue integrity. And I basically ensure that what we send out to the payers is in compliance with federal guidelines.
Perfect.
Any questions?
I think we're okay for now. We'll save all the questions for the end.
Okay.
So if you do have any questions, just please drop them into the chat box, and Norma and Vicky can answer them towards the end of the presentation for us.
Wonderful.
Okay. All right. All right. So typically, what are your daily job duties as a medical biller and coder? And do you interact with patients? If not, who do you interact with on a daily basis? And Norma, we can start with you.
Okay, basically the daily job duties of a coder is to read the records, and you're going to focus on the discharge summary, physician's orders, lab reports, and basically you're taking the written word and turning it into an alphanumeric number. So that alphanumeric number speaks to the computers and insurance companies, and that's how they get paid or reimbursed. And there's no interactions with patients. And basically you talk to the physicians on a daily or weekly basis. If you have questions about what they have written, you fill out a query. It's a form that asks the physician questions about their diagnosis. And basically that's what you do all day long.
Vicky?
The same. I do not interact with patients at all. Community Care Center is a federally qualified healthcare center, so we're a little bit unique in that regard. In that, we have 27 clinics in the Travis County area, and we mainly serve the underserved. And I work very closely with other billers and coders in our network, as well as our compliance team, to make sure that we are following federal and state coding guidelines. And since we are a federally qualified healthcare system, we get our money from the federal, we get a lot of our money from the federal government, Medicaid, Medicare. So our coding has to be in compliance with their coding guidelines so that we can reconcile the money that we get for various different, what I call buckets, so that we can reconcile the money that they are sending us or that we, for the services we provide. One of those buckets might be the COVID vaccines. We had a specific amount of money that was granted to us from the federal government. And whenever we do COVID vaccine clinics all over the Austin area, then we have to code that in a specific way to reconcile and show the federal government that we use their money wisely and appropriately. So things like fraud, waste, and abuse are definitely areas that we want to avoid. We want to be in compliance. So I work closely with our compliance team. I work closely with the providers to educate them. And I work very closely with the other billers and coders to ensure that they are coding correctly. And in the end, I try to make sure that we get paid for the services that we provide.
Thank you. I think that'll lead us into our next question here. So for our high school students who may be watching this video and interested in this pathway, what advice would you give them to prepare for a career as a medical biller and coder? And if possible, would you do anything differently? Norma, we can start with you.
Okay, what I would tell students, if they're interested in this field, to go ahead and look into Austin Community College and to start a program. Basically, the prerequisites are medical terminology, health data content, anatomy and physiology. We have a class called BCIS, and that's Business Computer Studies. And then we have elementary statistics. So I would advise them to get into school as soon as possible to try and get their associate's degree. It's only 2 years for an associate, and it can change their world. And let's see, would I do anything differently? And for me, no, because I started very early in this career, and I've gone through it all the way from the beginning to what I am now as an instructor and department chair.
Thank you, Norma. Vicki?
Well, I'll piggyback onto Norma because I would also advise that it's medical coding and billing can be a very lucrative career, and it does offer competitive salaries and high demand opportunities. As for me, I don't think I could do anything differently since I was re-entering the workforce. I had already gone to college. So I do recommend that all younger or freshly out of high school students would go to college and get those prerequisite courses in anatomy and physiology, medical terminology, et cetera. But if they are older, like some of your clients maybe, and college is not an option, I would recommend AAPC, the American Academy of Professional Coders. They do offer certification, and many employers look highly upon a certification from this organization. And they do offer complete courses in how to become a medical biller and coder. You can specialize in different areas of coding as such as OB-GYN, pediatrics, radiology, anything like that, even medical documentation, healthcare auditing, compliance. You can specialize in all those areas that were mentioned on the that little circle thing about the various occupations associated or closely associated with medical coding. Like I said, employers are just more likely to hire somebody that has a certification, whether it be through college or through another association like an APC. That's what I would do. But as far as anything I could have done differently, no, because I was already old when I fell into this career. I think I would be considered non-traditional.
And that's okay. A lot of our people, the individuals that we work with are also non-traditional as well. So it's very inspiring for them to hear that there's more than one way to do something. You don't have to be the fresh out of high school graduate in order to do something. So thank you for that, Vicki. I appreciate that. And I see we have Mary Keaton on the call with us. Thank you so much, Mary, for joining. Mary, if you want to go ahead and jump in on this third question with us. So it's, what advice would you give high school students to prepare for a career as a medical biller and coder? And if you would do anything differently, what would you do? Like, what would you have done differently?
Well, I went to school to get my degree in health information management. And so I wasn't really planning to be a medical biller and coder. But the thing that the advice I would give to students to prepare for a career would be to learn as much as they can about anatomy and physiology and medical terminology, and the health sciences. So that's the main thing I would, and to look around for opportunities for education. That's what I would advise.
Perfect. Yeah, so it seems like from what you ladies have said that those sciences like A&P, anatomy and physiology, will be a very big portion of being a medical biller and coder, and also the medical terminology.
Yes.
Absolutely. Yes.
Great. Let's move forward to our fourth question. All right, so I know earlier you all mentioned that you do not work directly with patients. And since you don't directly work with patients, how do you go about protecting patients' health information? And we can start with Norma, if you want to go ahead and answer this one.
Yes, we have a law and it's called HIPAA, Health Insurance Portability and Accountability Act of 1996. Basically, that is a law that says we have to protect patients' health information. In any facility that you go to and work, you have webinars, seminars, and they train you about HIPAA, security, breaches, anything related to patient information, their protected health information, PHI, all of those things are covered in your orientations and trainings.
I'd be happy to talk about how we protect patients' health information at work.
Yeah, okay. I think Vicki may have froze on us. So yeah, Mary, if you would like to go ahead.
No,
Go
I'm
ahead,
here.
Vicki.
I was just waiting to be announced. Sorry.
Oh, there you are. Yeah, Vicki, if you'd like to go, and then Mary, you can go ahead.
Okay.
Day to day in my job, we protect health information by, if anything is physically printed on paper, we shred it. And electronically, our software system, our software has an encryption software. We have an encryption software system so that whenever we do transmit health information, just in our electronic health records, it's encrypted, and any emails that we send to each other, our software system recognizes if we put the letters PHI in the subject line, that email is automatically encrypted to protect PHI.
That's great.
Perfect. Thank you, Vicki. All right, Mary.
Okay, I'll address about in the workplace. When a person is now, everybody's working on a computer, so everyone has to have a password to get in, and it's very closely managed. And they must not leave their desk or their computer station while they're signed in. They need to sign out. And when they're working on patient health information, they need to be sure that, that their area is clear of anyone that could be reading over their shoulder.
Yes.
And let's see, those are the main things, the way it is now. And also, of or anytime the office is empty, the door needs to be closed and locked. So anytime anyone, if one person alone is working and they have to go down the hall, they need to lock, close the locked door and to be able to get back and then get back in with their key. So it's very closely safeguarded. And I really liked Vicky's answer too, because I don't think everyone's doing that. And I want to spread hospitals probably are, but I think some others are not. So I want to spread that information out in the field. So that's my answer.
Thank you so much, Mary. And I just did have a quick side note with that. We did speak about how you protect patients' health information, by, locking your computer screen and shredding documents and just being cautious of your surroundings. But for our students who may not know much about HIPAA, what are some of the violations, or I guess what I'm trying to ask is, why is it important to follow HIPAA regulations? Like, what would happen if a patient's information got leaked or exposed to a party who didn't have access to it?
Basically, what would happen is, of course, they'd have to go to court and find them guilty of it. If someone steals records, it's a federal law. You go to jail. If you're convicted of a breach, you can pay up to $250,000 and spend 5 years in jail. And I don't know of anybody who has the money or the time to do that.
Right. That's right.
I
Thank you.
agree.
Thank you for.
I agree.
Thank
The fines are awfully steep as well for security breaches. Yes.
They are. And, even before HIPAA, those of us that worked in medical records or health information management, we already were protecting health information just, as best we could. So these laws just now enforce that you really have to, and they really protect the patient's health information. So I just wanted to throw that in.
Yeah, I think that's really important for especially our high school students to grasp the concept of HIPAA. Because when I learned it in high school, I wasn't that well versed on it. I didn't know about the violations, and I most certainly didn't know it was that big of a fine. So I think it's very important for our high school students to know just how important it is to follow the HIPAA laws and the regulations that are in place. So thank you for answering that side question. Okay, all right, we're going to move into our last question, and then we're going to open up the floor for any questions you may have for our panelists. So how rigorous is acceptance into the program at ACC, the Medical Biller and Coding program? And what skills should students possess to, I suppose, help their application with acceptance into the program? So Norma and Mary, if you would like to answer this one, and Vicki, if you would like to answer this one based on your own experience, you can do that as well. And we can start with Norma.
Okay, basically, you have to have a 2.0 GPA. You have to apply to the program and take those 5 prerequisites: medical terminology, health data content, anatomy and physiology, elementary statistics, and the BCIS, that computer course, because you do have to have computer skills in order to do your job. And we do use different programs in our different software programs at ACC. And the student should possess attention to detail, people that are detail oriented. what I say, if you like to solve puzzles and you like to be an investigator, you will do very well in this field.
Norma. Vicky?
Yes. So I did go to ACC, but that was many years ago for nursing. But as far as how I became a coder through AAPC, it is not rigorous at all to be eligible or to join. Anyone is eligible. The only thing you have to do is maintain a certain grade level in each of the courses, and I think they do have anatomy and medical terminology. I didn't have to take those since I was already had all of that as a nurse. But at the end, you have to pass the certification exam. It's about 4 hours long, and I think that is required even at ACC. To become certified, you have to pass an exam, and like Norma said, as far as the skills a student should possess is must be attentive to detail, must have the patience to investigate and to solve the problem. A doctor, since I work in a clinic system or an outpatient system, our providers might say something in a diagnosis like upper respiratory infection. Well, that's pretty broad. And you may have to kind of dig into the material to see if there's any specific, anything more specific that can be coded, because payers want to see specificity in the codes, as well as whether it was the right ear or the left ear that was infected, which side of the body, laterality. So you just have to kind of play that and be an investigator and make sure that the codes are as specific as possible. So just be willing to learn, have good communication skills with your teammates, and just enjoy it.
Hey, Vicky. Mary?
They have what I was going to say was about the attention to detail, that skill. And so Norma and Vicky have both covered that, but that is so important, because important for getting all the information you need to code, and then to select the correct code, because we have to code as specific as possible, and they need to be sure that they have all the characters that the code requires and so forth. So that's a real big thing, attention to detail. That was all I was going to add, really.
Perfect. Thank you. Yeah, I think that's really good to be able to point out attention to detail. And I can only imagine when you're having to send a document over to maybe insurance companies, maybe whoever you're sending, these codes to. I'm sure you have to be as detailed as possible. So I could only imagine how important attention to detail would be in this area of work.
Mm-hmm.
Okay. All right, so that was our last question for our panelists. Go ahead and move forward. I believe we still have Ashley on the call. So Ashley, I'll turn it over to you if you have any winter updates for us.
Thanks, Shannon. I wouldn't say I have a ton of, winter updates for anyone. I will say, as far as clinical placements go, we have started back at some of our Ascension locations for high school clinical placement. So that's very exciting. We are still working on getting St. David clinical placements back up and running. The major holdup to that is that they did, after the first of the year, after Christmas, decide that they were going to go and require vaccinations, COVID vaccinations for all students and faculty. And so that's been a real big burden that they're having to take on very quickly and get in order. They do have all of those requirements. Everyone who is attending clinicals does have to have those in by February 28th. And so we are coming to the end of that. So hopefully we'll know something by spring break if they're going to open them up for the last part of spring or just wait for the fall to start. So hopefully we'll have some more updates soon on that. Also, we are working on our website so that we can compile all of our information as far as K-12, all of the speaker series that we have recorded, all of the great work that Jessica's team has been doing for career pathways, we will have for you all in one place so that you guys can access that information. And that's all I've got, Shannon.
Perfect. Thank you so much, Ashley. All right. So the website that Vicki was referring to is on the screen here. And like I mentioned, I will be sharing this presentation out with you so you'll have direct access to it. And I believe Jessica already dropped this link in the chat for us, but our Climb the Ladder CTX website is where you can find those career profiles. And it's also where you can find some other resources to share with your students mainly. Like just helping them explore like different pathways and different industries. Again, not only in healthcare, but we also have things as far as skilled trades and manufacturing and many more industries. So definitely check out our website there to share with your students when you're meeting with them. Okay. All right, so moving to closing us out. We'll be closing out a little bit earlier today. So I just want to point out some of our upcoming events. And I know the screen looks pretty overwhelming, but I will also be sharing this with you all. So we have our K through 12 Skilled Trades Work Group webinar happening March 10th, hosted by Stephanie. She is the Career and Education Outreach Specialist for Austin ISD and Del Valle ISD. And she will be highlighting CDL and truck driving career pathways. So if you are interested or have a client or a student who has expressed interest in doing this pathway, maybe you can hop on and have your student join you for that webinar. Next, I want to point out our Metroplex Career Rally that we're having on March 23rd. This will be hosted by Local 286 Plumbers and Pipe Fitters. This will only be for high school students. And this is for students to explore different apprenticeship programs and just to get an idea of what it's like to work in the trades industry. One thing I like to say about apprenticeship programs, it's if you have a student or a client who likes working with their hands, definitely, allow them to explore some different pathways as far as apprenticeship goes. And then next we have March 31st, the City of Austin Youth Career Fest. This is a new date. It was originally planned for February 28th, but it got pushed back to March 31st. It will be from 9 a.m. to 12 p.m. And then this event is open to all middle school and high school students. If you have any questions, the email address is on the screen for you there. And then April 21st, we have ABC Careers in Construction Day. This will be an in-person event for high school students interested in construction, located at HEB in Cedar Park, HEB Center. And then we have our April 22nd, Austin Transportation Fair. Okay, we'll also be in person in Austin, located in Austin. And it will start at 10 a.m. to 1 p.m. And I also just want to point out that we have launched our teacher externship, our 2022. It sounds very strange saying that year still, but our 2022 summer externship program has been launched. So we are in the process of recruiting teachers, counselors. If you are interested in being partnered with an employer and learning more about a certain industry, whether that's healthcare or skilled trades or anything in tech or IT, we have those opportunities available to you so you can learn directly from an employer. And if we'd have any employers on the call who may be interested in hosting teachers for this opportunity, again, we're open to all IT, hospitality, healthcare employers who would like to participate and inform teachers of the pathways that are open to them. So we can drop a little bit more information about that into the chat, but we'll also send an email as a follow-up. Okay. And oh, Dina, do you have a question?
Yeah, I do. I just have a real quick question about the teacher externship program. Are we going to have some planning meetings beforehand to kind of decide like how many instructors we're going to take and things like that? Before, because I know sometimes it all gets planned out and they're like here. So I was just wondering if there's going to be an opportunity for us to provide some feedback before we arrange those folks.
Yes.
Hey,
and
Dina. This is Ashley. Hey, Dina. Yes, we are absolutely going to have planning meetings similar to what we did last year with the 3 healthcare providers. So everyone can kind of divide up and decide what they want to present on that week. Mm-hmm.
That totally answers my question and I appreciate that. Thank you.
Perfect. Thanks, Dina.
Thank you, Ashley. Yeah, so our teacher externship is there for you to explore. Our goal is to reach 100 teachers. So if you are interested, please definitely don't wait to register, sign up today if you can. And then lastly, I just want to point out how we mentioned earlier regarding our targeted occupations list. So the number on the screen is for you to call to find out if you're eligible for the resources and the funding that we can provide that is located through our TOL or our targeted occupations list. So I would highly just jot down this phone number just in case you are working with any students or clients who you think may be a good fit for this program, or they're probably interested in some of the pathways that we currently fund, just to see if your client or student is eligible for the programs that we offer. Okay, all right, and let's go ahead and move forward. All right, so I just want to point out our contact information. If you have any questions regarding this presentation or any of the programs that we offer or anything about the teacher externship, anything at all, please email myself, Ashley King, or Jessica Garay with all of your questions. If you do have any questions for the panelists here on the call today, you are more than welcome to direct your questions to either of us, and we can put you in contact with our panelists so that they could better assist you with your question. All right, so I just want to thank our panelists for being on a call with us this morning. I definitely learned a lot, especially the whole specialty thing. I'm still very interested in that. So I really do appreciate you sharing your knowledge with us here this morning, and not only informing us on the call, but informing our students and even those non-traditional individuals who may be interested in this pathway as well. And I also want to thank our audience, our participants, for being on a call and sticking through with us and listening to what our panelists had to say. So again, if you do have any questions or anything, definitely don't hesitate to reach out to us. We're more than happy to assist you with any of your concerns or questions that you may have. And thank you again, and enjoy the rest of your Monday.